Well, the up-to-date staff is lovingly referring to this segment as, does Kraske have dementia? I've wanted to do this one for a while for a very simple reason. I don't remember things as well as I used to, and it's bugging me. Lots of my friends in their early 60s are telling me exactly the same thing. So is there anything to worry about, or should I start stomping on the panic button? With us, Dr. Christine Boutwell is the interim medical co-director of St. Luke's Marion Block Neuroscience Institute. Dr. Boutwell, nice to have you. Welcome.
Thank you for having me, Steve.
Dr. Jeff Burns is back with us. He's director of the KU Alzheimer's Disease Center. Dr. Burns, welcome.
Thank you, Steve.
You know, just guessing here, Christine, that when people at cocktail parties learn what the two of you do for a living, that you get asked about this with some regularity?
Absolutely.
Do you? And what do you say?
Well, it depends.
It depends, of course.
There's always a context.
Yes, yeah.
So it depends on what kind of issues you're having, how much that's impacting your day-to-day life.
Yeah.
It's really, if it's impacting your life, then I start to worry.
Is it, you get asked this a lot too, Jeff, when you go
all the time.
Yeah. And you just, people find out and they just want to know, hey, doc, what do you think? I have a hard time. Yeah, whatever, right?
Yeah. I mean, everybody has forgetfulness and everybody's worrying about this right now.
Yeah, that's because Alzheimer's is still such a terrifying disease.
It is.
It scares people right to their knees,
It's one of the most feared diseases.
Yeah.
Yep, it is a scary thing.
What are we seeing in terms of the occurrence of Alzheimer's nationally? Going up, going down? What are we seeing?
Yeah, the numbers are rising rapidly, and that's because our population is aging. You know, the number of people over the age of 65 and the number of people over the age of 85 are rising as fast as any other segment of the population. And
the boomers are getting older.
The boomers are getting older, and Alzheimer's is an age-related disease, and that's just fueling a huge increase in the number of people with Alzheimer's.
Yeah. Well, I imagine, Christine, that I'm like a lot of people. Most days I'm going 1,000 miles an hour, and in the mornings I take a couple of glucosamine pills, and some morning it's 5 minutes later, and I'm thinking, did I take those 2 glucosamine pills or did I not? And what should I be thinking about there?
Right. I mean, that I even have that thought lots of times.
Okay.
So,
I feel better. That
helps.
Yes.
So really, if the memory loss is impacting you, and something that I've really found is patients themselves that truly have beginning dementia are generally not necessarily aware. Their family is the ones that notice these problems. Other people may notice their problems. They may intimately be aware in the beginning. However, I think a lot of problems with forgetting whether you took your glucosamine is that we're too connected all the time. We're with our devices. We're not getting proper sleep. We're multitasking constantly, so we're not getting the proper rest. So that's a function of multitasking, I like to say, that type of forgetfulness. But when it's really impacting your ability to function in life, then it's a concern.
I've had this thought before, Jeff, that this notion of what Christine just said, that we are constantly multitasking, trying to do 3 things at once. So many of us are doing that. Can that cause issues with your brain? Are you overloading the circuits, or am I being silly?
Well, so I mean, what happens there is your attention is pulled in a lot of different ways, and so attention's a key part of memory. If you're not paying attention, you're not going to remember. But inattention is not a sign of Alzheimer's disease, or it's a sign of being distracted.
Yeah.
So what, when we get worried about memory loss, it's when it's not inattention, when it's trouble with the brain putting new memories into the memory banks, which is different. We try to work out and distinguish between those issues. But as Dr. Boutwell has said, the key is, are we seeing interference with daily function, with the things that somebody's always done? Are they now having problems doing that?
Like, give me an example.
Well, let's see, balancing the checkbook, navigating around, finding your way around town, unfamiliar areas, forgetting how to get through Kansas City when before that was something somebody did very easily. Repeating conversations, asking the same question over and over again. That's probably one of the earliest signs that we'll often see is somebody will say, wake up and say, now, what are we doing today? Ask their spouse, what are we doing today? And then 10 minutes later ask again and again and again. And that's because the brain is not encoding that information and putting it into the memory banks.
I was going to say, Christine, what happens? Because a few years ago, as a reporter, I had phone numbers of politicians off the top of my head. I knew all kinds of stuff. And then suddenly, my colleague and I, Dave Helling at the Star, we would talk some days. He's like, who was that politician who served as state treasurer? We used to know this stuff off the top of our heads. Then suddenly we had to start looking it up. Why does that happen?
I mean, that can be a normal function of aging.
Sure, I get
our
that.
brains are at their peak when we're around 20 years old.
Oh, is that right?
We begin to lose neurons.
And it's downhill from age 20?
Well, I may
that
be wrong
explains a
on
lot.
that exact date, but, our neurons, we lose them normally. So there is a normal function of aging where we're not able to do all the things we were able to do before. However, with dementia, illnesses, and things, there are abnormal proteins and different processes that are happening in the brain that are then making those connections probably not possible. So it's normal to not be able to do exactly everything you did when you were young.
I was going to say, you're saying that is the way we work, that most people, by the time they're hitting 55, 60, 65, they're beginning to maybe not be quite in terms of they can't remember every single phone number they used to know.
Correct.
Yeah. Okay. Yeah, Jeff.
So, I mean, what happens with age, the kinds of things we see that occur with age in memory are more trouble with working memory, which is the ability to hold information in the memory banks for a short period of time and then use it. So the old-fashioned now example is looking up a phone number in the phone book, walking across the room and dialing it. So that's working memory. That gets a little less efficient, holding a little bit of information in the memory banks. And then the other thing that really changes with age is retrieval of a memory. So retrieval of a name or a memory is a little slower. So what you're describing is that sort of nuisance of it's a little harder to pull that information down. Even though it's in the memory banks, it's a little harder to retrieve it. And that's something that's pretty universal. I call it the tip of the tongue syndrome, and it's not something that really, is a strong sign of Alzheimer's disease, and so people don't really need to worry about that. It's when that information is not in the memory banks and not being put into the memory banks when we get worried.
Well, let's talk about Alzheimer's in just a moment here. And let me just remind our listeners that you're listening to Up to Date on KCUR. And we're talking this morning about memory loss and when do you know if you have a serious problem or if it's just part of the aging process. If you want to join our conversation, we'd like to have you. 816-235-2888 is our phone number, or you can tweet us at KCUR Up to Date. I'm visiting with Dr. Christine Boutwell. She's with St. Luke's Marion Block Neuroscience Institute, and Dr. Jeff Burns with the KU Alzheimer's Disease Center. Doing some background reading on this last night, Christine, I came across this line, and I'm quoting, "Memory loss is often one of the first signs of dementia." Is that an accurate statement? Does that sound right?
Yes, Steve, that's accurate.
It's what you're saying here.
That's definitely accurate. But memory loss, again, impacting your day-to-day function. And when we're seeing patients with Alzheimer's disease or one of the most common types of dementia, it's not just memory loss. They have other trouble functioning. They have trouble with speaking and recalling words, what we call aphasia. They have trouble recognizing faces of people that they know and agnosia, and they have trouble writing, and they have trouble with other executive brain functions just besides memory. So memory loss by itself does not equate to dementia.
Dr. Burns, Jeff, I had some questions about Alzheimer's and what we know about that. Is it connected to hereditary? Is it hereditary in nature?
Well, yeah, genetics plays a role. We know that, and in some very rare cases, families will have it in their genes, and if they inherit that gene, they'll get the disease. That's very rare. And for the rest of us, it's, you inherit a risk. You inherit sort of a genetic background risk. Which, the way you maybe think about high cholesterol and heart disease,
right.
Your chances go up if it's in the family, but it's not inevitable for most people.
Do we know what causes it?
I guess the short answer to that is no. And we've been arguing this for decades, the field has. Amyloid, there's things that build up in the brain, amyloid plaques, and then something called neurofibrillary tangles, and the field's really focused on those two features as potential causes of the disease, but but we're still debating it, and really one of the things that's holding the field back in terms of new therapies is we don't really have a precise understanding of what initiates Alzheimer's and what's the cause of Alzheimer's.
So is it fair to conclude then that if you don't know exactly what causes it, that finding a cure is all the more difficult?
It makes targeting, a cause much more difficult. And so we hypothesize, things like amyloid may drive the disease, and we've been going after amyloid for the last 15 years and coming up empty on that front. And so now we're hypothesizing other things. Maybe
When you say amyloid, you're talking about what?
there's a protein that builds up in the brain in people with Alzheimer's disease called amyloid, and accumulates in the brain. There's other proteins as well, and there's other things that go awry. But amyloid has been the dominant focus of therapies, in development for the last couple decades.
I'm going to ask you more about a cure in just a moment, but let's go to some phone calls here at 816-235-2888. What causes memory loss? That's our topic today. Bill from Leawood. Bill, you're on Up to Date.
How are you doing? Very good topic. Thank you for taking this on. We treat Alzheimer's and depression and other diseases, neuropsychiatry and neurology diseases, using a device called transcranial magnetic stimulation. This is by the FDA, and it's about to be approved for Alzheimer's. I wondered if you guys knew about it, number one. Speaking of what causes it, we are more targeting tau protein versus beta amyloid, but really both of them, and we look at it in the MRI to see whether or not we're changing the brain back to where it was. So currently our success rate with people up to mid-stage Alzheimer's from pre-Alzheimer's is roughly 2.5 years of activities of daily living being restored. In other words, middle names of friends, family, what street you live on, your social security number, your balancing your checkbook. So we've done about 13 patients. A company called NeuroAD out of Israel has an application, a new device application.
Bill, let me see if I can get Dr. Burns to respond. Do you know what the therapy he's talking about?
Yeah, TMS, transcranial magnetic stimulation.
Explain that to me in a layman's terms.
Basically, it's you put a device on the skull, but basically around it, and you magnetically stimulate the brain.
To what end?
To change the way the brain is sort of there. Those areas of the brain are firing, and so you can actually modulate aspects of the brain through these magnetic impulses very safely. It's being used in depression, as the caller just mentioned, and then there's some interest in Alzheimer's, and I think there's some hope. I mean, the trials need to happen before we know if it really is going to impact the disease, but I think there's a good reason to be very interested in pursuing that.
Christine,
as a research. Are
you
project.
interested in that? Are you watching this from afar, or yeah?
I mean, I would echo Dr. Burns in definitely using it in depression, and we've definitely had experience with that at St. Luke's. So, but looking at it further with more clinical trials.
Have you tried it at St. Luke's?
For depression.
What impact does it have?
There has been impact in treating clinical depression that has failed other medical therapies and been resistant to therapies, yes.
How consistently?
I cannot tell you the science numbers.
Gotcha. Bill, thank you for the call. Let's go to Elizabeth from Paola on the Kansas side. Elizabeth, good morning.
Hi. I wanted to ask, I have a sister that has Down syndrome, and Down syndrome is 95% correlated with Alzheimer's. I wonder what you've learned from the genetics of studying those people. It seems to me like I don't hear about that very much. Thank you.
Yeah, thank you, Elizabeth. The connection between Down syndrome and Alzheimer's.
Yeah, no, she is right. Every person with Down syndrome, if they live long enough, they develop the amyloid plaques of Alzheimer's disease in their brain, usually by the age of 40. And then if they live long enough, they more often than not develop Alzheimer's disease. The majority, if not all, will develop Alzheimer's disease. And the link there is Down syndrome has patients with Down syndrome have 3 copies of chromosome 21, which is a gene that has an amyloid precursor protein gene on it. And so that is thought to drive an increase in amyloid production in people with Down syndrome.
Christine, I'm wondering, in your work, when someone has been diagnosed with Alzheimer's, or you're pretty sure that's what is going on, how do you break that news? That must be a difficult moment.
Yes, it's always a difficult discussion, but I think it's paramount to be very direct and upfront with the patient and the family about the concerns. I think it's a good time, maybe in early forms of the disease or early stages, that patients have the ability to pretty much make their decisions about where they want things to go. If things are correct and things do tend to progress, that they make decisions about their living will,
estate and
their
everything
estate,
else. Yeah.
That they are an active participant if they can. I think that that's important. And just to start providing education about how to manage and cope as things go along.
And to be as aggressive as you can in terms of staving it off or staving off many of the effects.
Correct. There are some medications that can potentially maybe slow progress. They've been around throughout my whole clinical practice time. They have not produced significant impact, but they may help with behaviors and slowing progression of the disease. It's certainly not the cure that we want. We want, our drive is to fix people. We can't do that, but how we can help them cope and mitigate symptoms and
you sort of hear people talk that, keeping your mind active is the key. And, people do crosswords and math with at least part of their motivation is to stave off dementia. Is that effective? Does that really help?
I think the clinical trials regarding, cognitive exercises, so to speak, are somewhat maybe not clear. However, it's definitely known that increased or higher level of education and cognition to begin with, and actually increased aerobic exercise and physical activity throughout midlife really can maybe be a decreased risk factor for developing dementia later on.
Okay.
So
that's interesting. Yeah, Jeff?
So, this is our research area at the KU Alzheimer's Disease Center is lifestyle. How does lifestyle impact the brain and the health of the brain? And so we're undergoing very large studies of exercise and brain health and really trying to definitively prove that. We've got a lot of data that suggests it very strongly. So we have ongoing trials in actually sleep, diet, and exercise.
That's interesting.
But I tell all my patients, there are drugs. We need to use them. They help slow the symptoms. They don't cure it. You should do everything you can on a lifestyle front in terms of exercise, keeping your brain active and eating right. And then I think it's really important to participate in research and help move the field forward. Mm-hmm. We need to get to a cure, and the number one thing that slows us down more than anything else is finding volunteers for our studies.
Can you envision a cure in the next 5 years?
We're going to get there. I don't know when.
Mm-hmm. But you're confident that's going to happen in your lifetime.
I'm confident. I think it may be more complicated than one drug to cure all the disease, Alzheimer's disease. I think we're going to understand Alzheimer's as multiple diseases and go after those individual diseases in different ways.
So different people have different forms of the same thing.
Yes, and we have a long way to go to really understand that. But that I think is in our future, and I do think that more effective treatments are in our future.
But you need folks to take part in research, and how can they do that? If they can hear that, where do they go to help out with that?
Well, they can look us up on the internet, KU Alzheimer's Disease Center. They can call us, 913-588-0555.
Yeah.
We've got many, many trials and lots of opportunities, and they can be a part of the team and moving the field forward.
And you need folks.
Oh, we need them. Yep.
Okay. Melissa from Overland Park. Melissa, you're on up to date.
Hi there. I have heard Alzheimer's referred to as type 3 diabetes, and I'd like to learn more about that.
Yeah, so that's a great question, and we have a study underway right now where we're using a diabetes medication to see if that helps individuals with Alzheimer's, and that's where we are now. But that basically we've been for the last 15 years studying aspects of metabolism and how that relates to brain health, and that's another theme of our Alzheimer's Disease Center. Our scientific theme is metabolism. And so, there's a lot of links between diabetes and Alzheimer's, and that idea of type 3 diabetes is that there's insulin resistance in the brain as opposed to in the body. in people with Alzheimer's disease.
Dr. Boutwell, how confident are you that a cure or cures are coming down the pike?
I mean, I'm always confident that we're going to continue to progress in science and come at cures, especially in neurology being a cutting field. In my career, we've made great progress in multiple sclerosis and the way we treat stroke. So I think we can also do that with dementia. As far as, vascular risk factors, there's other types of dementia. Alzheimer's is one of the most common type, but there's vascular dementia, and very clearly addressing vascular risk factors such as diabetes, high blood pressure, high cholesterol, healthy lifestyle, diet, exercise.
Right.
Those are very, very important also, which really are going to what probably Dr. Burns is working on with the metabolism in some of his trials.
Okay, great information. We're going to have to leave our conversation there. That was the voice of Dr. Christine Boutwell, Interim Medical Co-Director of the St. Luke's Mary M. Block Neuroscience Institute. Dr. Boutwell, thanks very much. Appreciate it.
Thank you, Steve.
Dr. Jeff Burns is Director of the KU Alzheimer's Disease Center. Dr. Burns, thank you.
Great to be
Appreciate
here.
it very
Thanks,
much.
Steve.
You bet.